Hi everyone, and welcome back to ClinPsy Explained. My name is Ian, and I am a clinical psychologist working in the UK. And this series of videos is all about trying to help you understand what clinical psychologists do. This particular video, though, is about confidentiality and consent. Now, that might seem quite a dull topic, but this is really, really important stuff, and it underpins a lot of the work that we do. If you've watched some of my other videos, you know that I just flashed this up for a little minute for you to read. It's just a bit of a disclaimer about the thoughts and opinions expressed in this video. Confidentiality basically means whatever is discussed in a therapy room stays in a therapy room. Obviously, clinicians will be writing notes down, and these live in client files, which might stay on in locked cabinets. But only people working with that person should be able to read what's in the file. Other people can't just sort of go through and say, "Oh, I know that person. Let's see what's happening with their treatment." No, that's not appropriate. Equally, clinicians can't go down the pub or down to the supermarket and bump into someone and say, "You never guess what I've just sort of like chatted about back there with someone else." No, that's not right. We've got professional guidelines, and we just can't do that. What we discuss is confidential. Obviously, if a client wants to go home and talk with friends or family about what they've chatted about, that's fine. I mean, if they want to say that I've given some good or bad advice, that's up to them. The confidentiality clause is for the clinicians to sort of pay heed to. But you'll probably be aware that not everything can remain confidential. If there's lots of risks discussed in a room, we just can't sort of sit on that as clinicians. We need to make sure that that person leaving that room is then safe. So that might mean talking with friends and family, or maybe other professionals who are involved in that person's care to make sure that they remain safe. So I would always sort of say that what we chat about remains confidential unless you're at risk to yourself, risk to others, or risk from others. And then we might need to break confidentiality. But when we break confidentiality, we always try and disclose that and make it as open and transparent as possible. So I've got these concerns, I really can't hold on to them. I'm going to have to tell such and such, I'm going to have to share this information with them so that it's as collaborative as possible and decisions aren't made behind someone's back. Now, consent or capacity to consent means that someone is capable of making a decision for themselves and about their care. And anyone who's 16 or older is assumed to have capacity unless it's proved otherwise by doctors or whoever. So maybe for older adults who might have memory problems or dementia or something like that, means that they might not have capacity anymore. Or someone maybe who has severe mental health difficulties might be assumed not to have capacity, and so someone might need to act in their best interest rather than on what at that time that they're saying. But having capacity means that you can make bad choices if you want to, as long as you can have the mental faculties to weigh up the pros and cons and to retain the information. The reason capacity to consent is important is because whenever we enter therapy, we want it to be a collaborative process. We want whoever is sitting opposite us to feel that they want to be there and they're signed up to being there. And so being able to make the treatment choices that are right for them is really, really important. So actually consenting and sort of agreeing to a therapeutic treatment is really important. And if you're older than 16, then it's assumed that you can do that for yourself unless, as I've said, it's proved otherwise. If you're younger than 16, it might be up to parents to decide which is best. But as clinicians, that's a sort of difficult area, and we need to have that conversation to make sure that the young person in that case really wants to be there and feels the need to be there. as with the example that I've just given, if someone's younger than 16, then it's parents who have to consent to treatment options and various things because they hold parental responsibility. Now, I work in child services, and there's quite a lot of overlap between consent and confidentiality, purely because if something risky happens and someone's under 16, we have a duty of care to look after them and to keep them safe, and that might mean breaking confidentiality. But sometimes professional dilemmas maybe that crop up that challenge those, like clear rules. So here's an example. So maybe we've got a 15-year-old who's 2 weeks away from their 16th birthday, and they've come into an appointment with me and said, look, Ian, I'm self-harming and I don't want you to tell my parents. Now, what do I do with that? The consent legislation would say that I have to let parents know about that because they're under 16. But if they would have told me 2 weeks later, then I would have had to listen to the young person and not told the parents. So it's a professional dilemma. What do you do with that? You need to keep them safe, but you're bound by these rules and restrictions. So then it's up to us as clinicians to try and decide what's the best way forward. Do we tell parents and maybe risk not seeing that young person again because they feel that they can't trust me in those sessions? Do we kind of keep it to ourselves and not tell parents, but then we're sort of kind of like breaking the law there, but we might also be keeping that young person safe? Or do we try and work together and think, I'm really worried about you. I know that you're not 16, and I feel that I need to tell parents. And so we tend to try and come up with a bit of a collaborative plan to sort of share that risk and keep that young person safe. But that's why confidentiality and consent's really, really important, and there's quite a lot of overlap between the two. So that's it for confidentiality and consent, or capacity to consent. I'm sorry if that was a dull video, but this stuff is really, really important. It's important for clients to know their rights whenever they enter a therapy room, and it's really important for other people to know our professional guidelines and rules that we have to abide by, so that someone can feel confident in that therapy session and really engage in the process and not worry about what information is going to be shared, etc. So if you'd like to comment on this video, you can do it on the YouTube comment section. You can send me an email, or you can follow me at whatisclinsci on Twitter. Hopefully you'll join me for one of the other videos coming up soon, and bye for now.